Hello, I'm Levy. I'm the Chief Medical Officer for Public Policy and Strategic Partnerships at Teladoc Health, and it really gives me great pleasure to be able to present to you today about some of the changes we are seeing in terms of the landscape of virtual care. My own clinical background is practicing over 20 years full-time in the Boston area, teaching over at Harvard Medical School and in the internal medicine residency program at the Brigham and Women's Hospital. However, for the past 13 years, I've been very much involved with global health on a global basis. A little bit about Teladoc Health. We are a large publicly traded company. We actually last year had over 14 million visits either delivered or enabled. So in addition to providing services, we also provide technology to hospitals and health systems around the globe for individual clinicians to take care of their own patients in a variety of settings. As folks might know, we also last year merged with Livongo, and we currently have over 442,000 Livongo members. We have over 51 million US paid members. And we have a very robust platform that is active globally. And as you can see on the map here, we have offices around the world. We have a shared commitment with UPMC to the importance of medical quality. We really do believe that we are in a unique position. Being the leader in telehealth, we believe that it is our responsibility not just for our own patients who are being seen on the platform, but really for the industry at large to really take a leadership role. So we've established very robust relationships with URAC, with ARC, with CDC. We actually are doing several research projects right now. And it really is specifically as virtual care advances to always make sure that the quality of the care that virtual care is providing is absolutely improving the health of populations. We do believe that virtual care is increasingly essential to high quality hybrid care. I think that one aspect of the global pandemic that many have reflected upon is that it really was the seminal event that allowed virtual care to become quite mainstream in terms of the delivery of healthcare today. I think that it has been a long time since any one of us have stood in the lobby of a bank because you wanted to perhaps withdraw a little bit of money from your checking account. Yet that simple act is an act that I believe many times in healthcare delivery today, we are making patients do the same. We are making patients come into brick and mortar physical settings to resolve medical issues that could be easily resolved through a virtual solution. There are many important drivers that I'd like to share with you today about why virtual care is emerging in Europe as well as in other markets. Certainly the costs, certainly the clinician shortage that we're seeing, and most importantly, consumer expectations. Consumers, particularly with their experiences through the pandemic, really do see that virtual care can resolve so many of their healthcare issues. A couple of observations as we reflected upon that COVID did cause this rapid growth in telemedicine in 2020. We have an expectation that there is going to be likely a tripling of the overall market in terms of virtual care by 2025, so that it will likely be close to $150 billion market. Europe represents 20% of this global telemedicine market. So there's expectations that the European telemedicine revenue growth might be somewhere on the order of 30 billion by 2025. Obviously, this is an area which is very active in terms of investing and various M&A activities at the current time. In France alone, it was a period of forced innovation. Prior to the pandemic, clinicians in France, we're seeing approximately 10,000 virtual visits every week. Post-pandemic, greater than 1 million every week. And in Europe, as well as in many other markets, there is, as they say, a silver tsunami, a combination of lower birth rates plus people living longer has resulted in aging of populations around the world. I'm involved with the National Academy of Medicine. This is an area that we are keenly interested in looking into. And there's a WHO report that was done a few years ago in 2016, which really talked about this human shortage of clinicians due to this silver tsunami and individuals retiring from the healthcare field. So where do we go from here? Well, I think that virtual care can provide a lot of the solutions. There's been an expansion of a lot of other areas that really are fueling these so-called tailwinds of these trends. 5G expansion, there is the economic milieu that is really quite facilitative of increased virtual care, increased use of wearables, consumer demand, which we talked about, European geography, also quite important in terms of mountains and rivers and places where it is difficult for individuals to easily get to see, say, a top specialist for their unique medical situation. And certainly growing interest in terms of caring for individuals who are struggling with mental health concerns, as well as a growing interest in terms of the power that data analytics and AI can have to improve medical quality. Key elements of a data framework, which is going to really help to facilitate, we've got to be on the same page. Interoperability is so important in terms of being able to care for individuals. We need to have standards around data. We obviously need to be highly compliant with GDPR. We need to be supportive of research and AI and really recognize that public-private agreements need to understand that there's a careful balancing here. There's risks to not sharing data, and there's risks to not learning from these experiences. So we really do need to promote this notion that we want to understand the power of real-world evidence to really understand what's going on virtually so that we can have a really good understanding of what is necessary to produce high-quality virtual care. These are just a couple of views from the field from Carlos Nueno, who's our president of Teladoc Health, who notes the growing use of medical devices, as well as Jonathan Larson, CIO of Ping An, who notes that this really was, the pandemic really was the moment for virtual care. We believe that virtual care is increasingly going to embrace what we call whole person care. Wellness and prevention, primary care, acute care, chronic care, complex care, all coordinated in a unified patient experience. So not so much a knitting together of point solutions, but rather an ability to meet individuals wherever they might be on in terms of the healthcare spectrum. We believe that this hybrid care is really going to be a careful interweaving of both the virtual and physical care experiences so that we have remote patient monitoring, AI, data, but we also have clinical care, individuals that can basically escalate when it is necessary to get a clinician involved in terms of the overall care of the individual. This longitudinal journey really does represent an interplay between digital solutions and people solutions in terms of caring for individuals as they go through their healthcare journey. We believe that there is growing relevance across the disease spectrum, both in terms of critical care, where we have some very exciting studies coming out in terms of an ERIC study that will be coming out of Charité Hospital in Berlin, where we really can see the power of virtual solutions to extend top quality care to neonates through a whole network of hospitals, all through virtual solutions, to episodic care, individuals who have much less acute medical problems. However, an important point that I would like to very much stress is that if you look back over the history of virtual care, it is definitely a story of if you build it, they will not come. You cannot simply have digital solutions available to individuals and expect that individuals are going to come and seek care through a virtual route. Very much in the mindset of most individuals, even today, even post-pandemic, is I have a medical problem. Who do I need to go see? So in order for a virtual solution to be really exciting, relevant, and robust, it must be communicated adequately. And we can use data to make sure that our communication strategies are getting heard by our audiences. And we can also have a whole robust digital engagement, what we call surround sound, but it really is a method of making sure that individuals recognize that whether it is through their doctor's office or through their insurance program or through any other means, if they have access to virtual care, we want that to be top of mind. So individuals at that point of need recognize and understand that they do have this virtual solution. So in conclusion, as Winston Churchill once said, never let a good crisis go to waste. We do very much believe that these past many painful months of going through COVID, and obviously it is not over yet, we do believe that virtual care has really shown itself to be a highly efficacious way in which individuals can get the care that they need. And importantly, we are seeing how virtual care and physical care can fit so nicely together in terms of hybrid care that we believe strongly will be improving the overall health of populations in years to come, as well as the overall cost experience, and importantly, overall member and clinician satisfaction. Thank you so much for your time today. I really appreciate it. And I believe that we are going to have some time for some Q&A as well. Thank you very much.